Alistair Burns is my name and I'm the National Clinical Director for Dementia in NHS England. What I'd like to do in the next couple of minutes is to talk through some of the thinking and some of the aspirations around NHS England's ambition that 2/3 of the estimated number of people with dementia should have a diagnosis and post-diagnostic support. We know that the rates of diagnosis are relatively low overall. It's about 48%, so less than half of people, the estimated number of people with dementia, have a diagnosis. But we know that there is significant variation from 38% to 76%. We also know that that's what patients with dementia want. They want a diagnosis, they want investigations, and there are a number of surveys from the Alzheimer's Society that suggested that is the case. When we were looking at what rate we should have, the aspiration was that we should match places like Scotland and Northern Ireland where that diagnosis rate has been achieved. And when we look at CCGs around England, we know that a number of CCGs, in fact if you look at ambitions, the majority of CCGs are achieving that level of diagnosis and post-diagnostic support. There are some things we're doing in NHS England to actually see what we can do to help. So for example, the Dementia Prevalence Calculator is a local guide to the estimated number of people with dementia. It takes into account care homes, for example, and that was published in March in 2014. So that's something that is available as a guide. We know that the coding for people with dementia can be improved. So these are people who have a diagnosis, and if that is coded correctly to give an accurate clinical record in primary care, that can increase the number of people recorded by as much as 10%. And we've done a series of visits to clinical commissioning groups to look at some of the aspects of care, things like training, working with social care, having strong local clinical leadership, and in uptake of the enhanced service for dementia are things that we know can help the rate of diagnosis. Examples, for example, in Tower Hamlets, I know that they have used looking at the prevalence rate to increase and enhance the journey of people with dementia from early and timely diagnosis to end-of-life care. So the ambition is that by next year, 2/3 of the estimated number of people with dementia should have a diagnosis and post-diagnostic support. This is not something that's going to increase year on year, and it's very much to look specifically at what's available locally and to encourage colleagues to increase the quality of diagnosis, numbers of people with diagnosis, but all important post-diagnostic support. Thank you very much.